Consider this, a medical device that can shock the heart back into normal rhythm to avoid sudden cardiac death. Hello everyone, my name is Anya Zielinski and I will be discussing with you today the implantable cardioverter-defibrillator, otherwise known as an ICD. To put it in simple terms, the ICD is a device that is surgically placed to help detect and treat dangerous heart rhythms. The leads of the device are attached to the heart, and the device functions by detecting the occurrence of a deadly rhythm. At this point, the ICD delivers a shock which restores normal rhythm. Indication for the placement of an ICD is based on many factors, including pre-existing cardiac structural abnormalities, which places patients at a higher risk of experiencing a lethal rhythm. This medical technology can prevent sudden cardiac death in individuals with risk factors. Once the ICD is implanted, monitoring of the device takes place in many ways. The ICD can store and transfer data, including heart rate and rhythm. The patient is given a monitor which they keep in their home. For the device to transmit data effectively, the person with the defibrillator must be within proximity to the monitor. It is important that the provider informs the patients to be aware of the symptoms associated with an abnormal and rapid heart rhythm. When patients experience symptoms, they should utilize the handheld wand which comes with the monitor and place it over their ICD. This allows the data from the ICD to be remotely transferred to a database where providers can evaluate and review the findings with the patient at their next follow-up appointment. Follow-up visits with a device specialist are necessary for assessing device functionality and investigation of any concerning data received from the device. During these visits, the specialist will also examine if any instances took place where a shock was delivered and it was not needed, which could occur due to battery issues or lead failures. The monitor also automatically transfers data to the stored database if a medical emergency occurs in which a shock is delivered. At this point in time, the device specialist will contact the patient to schedule an appointment and discuss events leading up to the shock. Recognizing patterns of when the heart rhythm becomes abnormal can help patients change any lifestyle habits contributing to the occurrences. For this technology to be useful for patients who need it, patient education should be provided regarding battery life of the ICD and replacement of the monitor. Generally, this medical device should be replaced every 10 years, though the length of time can vary on a case-to-case basis. Limitations to this device exist. Not everyone has access to technologies like the one described. A cardioverter-defibrillator costs thousands of dollars to have implanted, in addition to the cost of medical bills for post-operative hospitalization and follow-up visits. Without equitable access to healthcare, this technology is not an attainable option for many patients experiencing deadly arrhythmias who require this device to manage as well as treat dangerous rhythms. Other limitations include patients do not readily have access to the stored data transferred from the wireless home monitor. Individuals would benefit from having an app on their phone where they could view their heart rhythm for their own safety and concern. Patients who have ICDs don't have access to the data taken from their medical device, while medical professionals do. Let's think about that for a moment. Although it is crucial for device specialists to have access and receive the transferred information to address and correct any issues, it is equally important for patients to view their medical data at their own discretion, especially when the data relates to a vital organ which keeps blood pumping through the body, essentially keeping patients alive. In compliance with HIPAA requirements, information stored and transferred by ICDs is shared solely with patients, treating physicians, and researchers. Similar to other types of patient data, HIPAA regulations apply to patient information that is encrypted and wirelessly transferred from implantable cardioverter-defibrillators. Prior to placement of the device, there may be few discussions surrounding the topic of privacy regulations. Limited research shows perceived benefits of the device outweigh associated risks of data intrusion. Ultimately, the device stores and transmits data which healthcare professionals assess, recognizing errors in the device and improving usability to provide best practice. It is in the patient's best interest to have devices that are accurately identifying and recording cardiac events that may become detrimental to their overall health. Thank you.